to me. It's beeping.
Just now started.
Here it goes.
Okay.
Sorry, it's a restart.
Hi. Today we're going to learn about cleaning the care of ostomy and repouching the stomacytes. Before we get started, we need to identify the name and date of birth of our client. You don't necessarily have to have a doctor's order for this because it's going to be a PRN depending on the condition of the patient's wafer and bag about when you need to change it. Typically, the wafer needs to be changed at least once a week, the bag every few days. However, if there's any break in the integrity of the bag or the wafer, it would need to be changed under those circumstances. So we've still identified our patient name of birth, walk in, clean your hands, don clean gloves. What you're going to do first is you're going to need to empty the existing bag. In order to do that, you're going to have a graduated cylinder, and you can typically, if the patient is bed bound, the bag is going to be positioned how you see it here, how the opening is on the side. So if the patient needs to, they can roll, or you can have them roll a little bit, and you can drain the fecal effluent out by gravity and by assistance as well. See, it opens, or let me turn it this way where you can see it. Back. There we go. How it opens, but it's still kind of tight, so you have to give it some pressure to open it. And then you're going to drain it. Sometimes you have to push the fecal effluent down into the graduate cylinder to measure and then flush it down the toilet and rinse out your container. It's also important, if you're going to keep this bag, that you clean the excess stool on the edge of the bag prior to closing it back up. All right, but even if you're going to change it, you want to go ahead and seal this bag back up, because remember that with colostomies, they have continual drainage of the feces. So I would go ahead and seal that up prior to removal. Okay, now you're going to dispose of the fecal effluents, and I'm just going to set it here for now, but pretend like this is clean and empty at this point. Okay. Now the next thing you're going to need to do is to remove the wafer in the existing bag. If you're only changing the bag, if it's a two-part system, it just unclamp off. This might be a one part. If it is two parts, the bag will disconnect from the wafer, but with one part systems that they are adhered together as one piece. Okay, in that case, you're going to take the wafer and you're going to hold the skin taut as you pull the wafer adhesive around the perimeter, and then you'll take it off of the stomacyte. And be prepared with the towel that you're going to place around here, because it will be draining. And place this in a biohazard bag. Okay. Next is you're going to need to clean the site around the stoma. You're going to use warm water to clean the stomacyte. Clean it, and then you're going to get a new washcloth and pat dry. This mannequin has been used quite a few times, so you see there's quite a bit of adhesive. A patient's skin may have some adhesive left on it as well. So let's pretend this is a new washcloth now. We're put it there because the patient, we already had them roll a little bit to keep the effluent from getting onto the bed. And you have adhesive tape remover pads that you can clean the skin, the adhesive. Oh, you see that's working pretty well on this little mannequin. So you're cleaning the site, cleaning off that old adhesive. And remember, you're probably still having some feces come out. So periodically you may be patting the stomacyte to get rid of the extra feces. But ideally, you would make sure that this is really nice and clean prior to applying a new wafer and bag. Also, at this time, you need to be assessing the side of the stoma, making sure that it's beefy red in appearance. This one's a little pale due to age of this mannequin, but it should be a beefy red color. If it were pale, that would be an adverse finding, or if it was cyanotic, it would be an adverse finding as well. All right, now we have assessed the stoma. You're going to document, and you're also going to assess the skin around the stoma to make sure it looks intact, that's not red, that there's no erythema or signs of breakdown around that. All right, her skin looks well. Next, what we're going to do is measure the or stoma size, you either have a transparent measuring device, as you see here, where you can hold around and see that this patient's stoma is right above 3 centimeters in diameter. Or some kits come with another disposable measuring where you have the holes and you can see which one. So this one is in inches, and you see it's 1.25 inches in diameter. At that point, you'll see whichever size, whichever measuring device you have, and then that's going to be the system that you use to measure your wafer. Before we get to that, let's talk about a few different types of bags and wafers that we have available. One is, you see, for starters, this is a one-piece system, and it has a narrow opening. Do you think that a lot of thick feces can come through that narrow opening? No. So what type of drainage bag do you think this is used for? Urine. So this is going to be for a urostomy bag. All right. And then you see these ones that are made for stool, they have wider openings made for the feces. All right. With your wafers, you also have different types depending on the manufacturer. And what I want you to see is not only are they different in diameter, see, one is more oval and one is more circular. This one, you see, is all rubber on the inside, so you can cut it to size if need be. And this one is plastic above the over the rubber, so you cannot cut this one to size. This one is a pre-size wafer for your stoma. All right, so measuring with we have the 1.25 inches. Do you think that this one will be the appropriate size? I can open it up. Maybe you'll be able to see it a little bit better. Is this the correct size for the stoma? Or is it a little bit too small? A little bit too small. So what if you place this wafer on the stoma, what would happen to that stoma? You're going to push it down and you're going to compromise what? Circulation to the stoma site, which could have an adverse effect. So you would not want to use this one. And with this one, it's the wrong size as well. So what is that going to expose? The skin. And which could cause what? Skin breakdown at the site. We were working on this one, but I do not have one available right here that will fit that stoma size. However, when we look at this wafer, and a patient normally wouldn't have 3 ostomies, as you see there. Would that one fit? Mm-hmm. We just might have to cut it a little bit bigger, maybe in certain areas, for it to fit perfectly. But we can open this up in a minute and see. If it does have a place where you can cut, you need to make sure that you cut with that adhesive backing on it. If not, this rubbery wafer will get stuck to your scissors. It'll be very difficult to cut. So make sure that you don't take this backing off until you have this cut to the appropriate size. Okay, before you apply a wafer on the stoma, though, you have some other devices that you can use, or types of skin prep. One is you have a package wipe. It's called a protective skin barrier. And this will make the patient's skin become real tacky. After it sits for a while, it'll make it more adherent to adhere the wafer better to the skin. And now since I touched that, I'm going to have to change my gloves because my gloves are going to be real sticky. But you will wipe that on the surface of the clean skin prior to applying your ostomy. You also have available, depending on your patient's preferences, skin paste that you may apply around the site of the stoma prior to applying the wafer, and you may also have protective powder for the skin you would put over the paste next. Or you may have one or the other. It all depends on the patient's skin and their preferences and what they've used in the past that has worked. And then also the last thing I want to show you is a deodorant. It's a liquid deodorant that you can insert a small amount into the patient's bag to cut down on the odor. Sometimes it's a liquid form, sometimes it's a tablet form to help. All right, so we're going to say that now we have moved, we're going to apply we're moving to this other stoma. What kind of, we learned about different types of colostomy in class. What's the big difference between this one and this one? The stoma opening. This is a loop, and this is a end colostomy. So you see with the loop colostomy, you have two openings. One is for the fecal effluent, which is the one that's more proximal, and then the more distal one is just for the mucus and the other discharge from the stoma opening. This is temporary or permanent? Temporary, because remember the bowel is intact, and typically it has a little rod underneath the loop of the colon to keep it in place. And then the end colostomies, they can either be temporary or permanent. Okay? And remember, the more proximal the stoma site is, what about the stool consistency? The loose it is. And the more distal the site is, the more dense or solid the stool consistency is. Okay. Now we have the wafer, we have prepped the skin. And if you need to cut to size, you would cut, like I said, with the backing on this. So I cut it a little bit bigger. I'm going to hold it back over the size, and now it looks like it fits it pretty perfectly, right? So I just had to make it a little bit bigger. Next, what you're going to do is you're going to, and if it's a two-piece like this, you can go ahead and adhere, clip the bag onto the wafer. I want my bag turned though. So that way you're not having to press down as hard on the patient's skin. I hear it. And I'm just going to undo backing. So you see it's adhered nicely, or it would be adhered nicely to the patient's skin. Okay? And finally, you need to ensure that the end of your colostomy bag is sealed closed. You may have different types of closure devices. You may have Velcro, as you see the one here, or it may be a clip device that clips it and locks into place. Remember, one of the first things you do when you teach a patient with a new colostomy about care of the bag is how to simply open and close the bag by themselves prior to them actually stepping up and caring for it completely. Okay, I believe that's about it. Do y'all have any questions?